Welcome, everybody, to another episode of our Divine Farmer Health Podcast. And my name is Jimmy Yin. I'm the Acu Sensei. And today you just have me. Today, Chris needs to take care of some family issues. So I'm gonna be running the show today. So we're gonna do something a little different. I'm going to go over still some information about, what Chris and I were talking about last week. We're talking about, the metabolism. We're talking about, research. But one thing that I wanted to share in regards to fasting, right? Because so many people have so many questions about fasting and how do you fast? Is it the right way? Is it the wrong way? By the way, before I continue, we are streaming live on YouTube and Instagram. And so I'm going to click on my Instagram. If you're on Instagram, you can actually on Instagram or YouTube, you can type in the question that you may have. It's Ask the Acu Sensei question today, all right? So type in your questions and my team will feed me the questions and then I'll answer them. So lucky day for those of y'all who are tuning in and showing up. Showing up is one of the number one rules for success. And when you show up, you never know, you might get an opportunity. And today may be the opportunity to get your questions answered from the Acu Sensei. Okay, awesome. So let me finish what I was talking about intermittent fasting, and then we'll go into questions. So intermittent fasting, is there really a right way or a wrong way to do intermittent fasting? And the short answer is no, there isn't, right? There's so many different ways. People will tell you, oh, it needs to be 14-hour fast, 16-hour, 24-hour, the answer is it depends. Why does it depend? Because your body is different from someone else's body. It doesn't matter. You're the same height, same race, same age, same weight. Doesn't matter. Your body, your organ functions are different from your neighbors, from your spouses, from your kids, from your siblings. It's all different. So, the best way is not to copy exactly what someone else does without monitoring your own body. So how do you monitor your own body? The best way to monitor your body, you have to get in tuned to listening to your body, right? Listening to your body, what does your body do? If your body is functioning at optimal levels, you will have zero symptoms. Let me repeat that. If your body is functioning at optimal levels, you will have zero symptoms. Symptoms are a way for your body to tell you, right? To tell you, hey, something's wrong. They're kind of like when you're driving in your car and you see, you see there's a warning light flash on. That's telling you, right? That's the car's computer telling you something's wrong with your car. Symptoms are like those warning lights, right? You have those warning lights. They should not be going on. They should not be going off. So what does that mean? You should not be having symptoms every day. It is not normal. It is common. Everybody's like, oh yeah, I feel tired today. Oh man, I'm hurting here, but it's okay. I feel it every day. No, it's not okay. That's not okay. Just imagine you're driving your car, a warning light goes off that says engine light's going off. Do you think, oh no, that's just okay. That's just the engine light. My engine's fine. You just keep driving until your car breaks down and then you got to buy a new car, right? Well, with a car, you can buy a new car. With body, you can't buy a new body, right? At least not yet. Maybe AI will advance enough to give us a new body, like we see in what's that Black Panther movie, right? So you can't get a new body. So if you are getting symptoms, insomnia, poor energy, inability to lose weight, hair loss, migraines, neuropathy, infertility, these are all signs that your body's not functioning at optimal level. Your organs are not functioning at optimal levels. It's your decision what you want to do with that information. But come back to, I can go on a tangent with that, but going back to fasting, intermittent fasting, your body tells you information. So what's the important thing about intermittent fasting? Chris and I discussed it's stimulating or activating autophagy, which is self-cleaning. Like you need to clean your house, right? Because if you don't clean your house or you clean your car, you're going to have a mess. You're going to be living in a pigsty, right? So same with your body. Your body needs to be self-cleaned. And we have a self-cleaning mechanism, autophagy, that is activated when we're fasting. That's why, you've heard we heal. The best time to heal is when we are sleeping, because that's when we're fasting. Now we can do extended fast to allow what I call the street sweepers in our body to clean all this mess in our body. Have a little more time to clean up the mess, right? So how do you know if you're doing it right? That's probably what you're asking. Probably what you're wondering. Here's one strategy that I use. Okay. Again, you have to be paying attention to your body. And I learned this from one of the books called The Enzyme Factor. The Enzyme Factor is written by a gastroenterologist surgeon who talks about diet. Ooh, who would have thunk, right? So this is when you're fasting correctly. You have this little hunger, like you're just a little hungry. Like you're not really full-blown hungry yet, but you're just a little hungry. That's when that is the symptom that lets you know, hey, my street sweepers, they're working, they're cleaning. Okay, I need to let them clean, right? So you're just a little bit hungry. It's like after you eat a meal and you're like, in Chinese medicine, we call this 80% full. Now, it's hard to quantify, hey, am I 80%? No, I think I'm 81%. Oh, no, I think I'm 86%. It's hard to quantify that. So how do you know? It's when you eat and you're like, I could eat a little more, but I shouldn't. I need to stop, right? If you do that, you probably will get hungry in about 3 to 4 hours, right? That is how much you should eat when you eat your meals. But when you're fasting, you want that little hunger sensation. Not a voracious hunger, just a little hunger. And then you can drink some water and it kind of satisfies that hunger a little bit, right? So when you're first doing intermittent fasting, it's tough. I know it's tough because you're not used to that hunger. That little hunger sensation. We've been taught like, oh, if you feel hungry, you should eat, stuff your mouth, eat. You should never feel hungry. No. You should have that little hunger sensation. Yes, you need to have a lot of willpower to stop yourself from picking up that donut. I know, I love to eat, right? But you got to think about, hey, what's more important? Instant gratification. Okay, I get a little donut, I get a little carbs, some spaghetti, and it satisfies me for a few seconds. And then I feel terrible afterwards. And also I don't hit my goals. Having healthy goals. So you need to choose healthy goals, delayed gratification, or instant satisfaction, instant gratification, right? You got to choose. So that's one important thing that I wanted to share. You want to embrace that little hunger sensation. That is a clear indication your body's cleaning itself. Okay. Now you don't let that hunger sensation get to a voracious point. Right. So what can you do if you're in between meals? If you didn't eat the right meal and just like 2 hours later after you eat and you're hungry, that's a problem. That means whatever you ate is the wrong thing, or your organs are severely malfunctioning. You shouldn't be hungry 2 hours after you eat. But let's say you are. Don't pick the sugar stuff. Don't pick carbs. Carbs are sugar. They're no different. What you want to do is pick some fruit, some complex carbs. So let me rephrase. You don't want to pick simple carbs. You want to pick complex carbs, right? Grab some fruit and eat it. Not fruit juice, but you want to eat, okay? So, but you should not be hungry until 3 to 4 hours later. If you are, you ate either, number one, you ate the wrong thing, or number two, your organs need a lot of help. And that's the thing about, this podcast. This podcast is different from other podcasts in the sense that we're not telling you just to eat, just what to eat, just to eat, not what supplements to take. Oh, recent research says this supplement will do blah, blah, blah. You should take this supplement. That's not what this podcast is about. This podcast is about teaching you how you can take control of your health again, how you can get your body to do what it was built to do, but you just ruined it. We all ruined it, right? But how do you get back to it? How do you get back to the state where your body's healing itself? Because here's a secret, it can do it because it was born to do it, right? We just messed it up along the way. So super important. Our podcast is about how to restore organ function. Nobody else talks about this. You don't restore organ function by taking a supplement. It can help, but that's not the solution. You got to change your lifestyle habits, right? So if you want to restore your organ function, if you want your body to be able to heal itself, right, and fix all of these symptoms that are coming at you, headaches, tinnitus, numbness, poor vision, bad hearing, bad memory, fatigue, right? If you want your body to heal itself, you need to restore the organ function. That is the only way. That is the only way to get your body to heal itself again, is to restore organ function. And if you don't do the things that restore organ function, you will never have your body heal itself. You will always be dependent upon a pill. And it doesn't matter. Like, I take supplements too. I'm not saying supplements are bad. I take supplements myself, but I'm not dependent upon it. But if you don't restore your organ function, you're always going to be dependent upon a pill. That could be a medication, that could be a supplement, right? Now, if you're happy with that, then great. That's awesome. More power to you. But that's not what this podcast is about, okay? So let's go over some questions. We already got some questions in, so I'm going to start. Thank you for tuning in. So I'm going to just go down these questions, all right? Let's see. Sosa Boss asks, can I do 30-day fast with just liquids? You can, right? You can. And there's a lot of these juice diets, juice fast, and liquid fast, right? You absolutely can do that. Do I recommend that drastic? Not for everybody. So it depends. You definitely need to, oh, I forgot to give the disclaimer, the medical disclaimer. Everything that I share is not medical advice. I am not a medical doctor. I am not a physician. I need to say these disclaimers. Otherwise, Big Pharma is going to pay Instagram, YouTube to shut my channel down. So I need to say those things, right? Not that I want to say those, but I need to say those things. But you need to consult a physician before you do any type of drastic 30-day fast, right? Why do you need to consult a physician? Because it's not because you need medication. It's because and it's not because they understand how to do a 30-day fast. It's just the law, right? I need to say these things. It's kind of stupid, but it's also helpful because you want to go to your physician because you want them to monitor. You want them to help you have those diagnostics. I love this about Western medicine. They have great diagnostics. So you need a physician in order to get those diagnostics, right? So those diagnostics, blood tests to make sure, or ultrasounds to make sure that nothing's, severely malfunctioning, because a 30-day fast is pretty drastic, right? Now, let me give you some pointers on that. If you're going to do a 30-day liquid fast, you do not do fruit juice. Big mistake, of liquid fast. You can do vegetable juice, okay, like juice extracted, like you do an extractor and it goes, and then one end comes out the pulp, and then the other end comes out the juice, right? You can only do that for vegetables. Do not do that for fruits. That you're just drinking sugar all day, right? So liquids, no coffee. I know some people say, oh, you can do coffee. No, can't do coffee. Coffee is a stimulant. Coffee will activate your adrenal glands to secrete cortisol, which is a stress hormone. Okay. It will cause your body, increase cortisol, which is a stress hormone. Okay. I'll come back to that. A stress hormone that basically causes your body to secrete sugar into your bloodstream. So it will spike your blood sugar and spike your insulin. Okay. So very important. You don't want to do any type of fruit juices. You don't do during the 30-day fast. Okay. All right. Bama finesse. Different frequencies individually. Oh, I don't know if that was a question. Okay. Don MacArthur asked, is it okay to fast with hypothyroidism and Hashimoto's? Again, this is not medical advice. In my clinic, we for some, not all, everybody's different, okay? For some Hashimoto patients, we do. Actually, a majority we do. If you have thyroid issues, because it's a way to self-clean, right? People say detox, right? Detox basically takes the toxins from your cells. All of our cells, especially our fat cells, store toxins. So detoxing basically encourages those fat cells in all of our cells to poop out those toxins that they store. Now, where do they poop it out? They poop it out into your bloodstream, right? Because that's the only way they have to poop it out into your bloodstream, because it's through your bloodstream those toxins will travel to your kidneys, to your intestines, so you can pee and poop it out. Now, during that process, you're going to feel terrible. Why? Because you got poop in your blood. I would feel pretty terrible if I had poop in my blood, right? So again, you got to be careful. Again, you need monitoring. You need a healthcare practitioner to monitor you, right? But again, I have to say a physician. So you can, to answer your question, yes, you can, but you got to be monitored by someone, right? And every Hashimoto patient is different. Again, just because you're diagnosed with Hashimoto's, your friend's diagnosed with Hashimoto's, what they're doing, what you're doing may not be the same. Okay? Because your organs, why? It all goes back to organ function. Your organ function will determine how much you need to fast or not. All right, B French Tutor asks, I have been doing intermittent fasting for 2 weeks, but not much weight loss. Any advice? Yeah. So most people do get weight loss of intermittent fasting, right? So there's many reasons why you won't lose weight during intermittent fasting. Is, depending on what you do. What are you doing when you're fasting? Like I said, some nutritionists or functional medicine practitioners may say, oh, you can drink coffee, you can drink tea, you can drink fruit juice, during your fast, right? For me, those are all no-nos, because sugar, if you're drinking fruit juice or you're drinking any juice, that's not fasting. You're putting sugar in your body. Coffee is a stimulant. It's stimulating. Remember, fasting is to help clean out your organs, not to make them work, like stimulate them. So caffeine, if you're sensitive to caffeine, I would say no to tea also. No to tea, definitely no black tea, no coffee. Those are all caffeine, no energy drinks. They will stimulate your adrenal glands, which flood your body with sugar. You're no longer fasting when your body's flooded with sugar. So what should you drink? Water. Fasting is just water. That's it. Yes, you can squeeze some lemon and lime, right? It makes it alkaline, but nothing else. That is pure fasting, intermittent fasting, right? Also, another problem, or I would say mistake people make, is when they're fasting, you get hungry, right? Obviously, in the beginning, you get really hungry. And so you just devour your food, and you're eating the wrong foods. So basically, you canceled out all that hard work of holding out to eat. You cancel out by eating the wrong things or eating too much. So when you're fasting and you eat, you still got to eat 80% full. Remember, you need to have that little hunger sensation. Okay. All right. Next, Pro Joyce says, I did 16-8 if for 15 weeks with little weight loss. What did I do wrong? So same, you have to evaluate. It's not So most people don't mess up with the hours of fasting, right? Whether it's 16, 14 hours, that's not the crucial part. The crucial part is what you're doing during the fasting. Are you drinking water? Are you flushing it out? Remember, so your street sweepers are going through your body. They're going to street sweep it. They're going to put it into the blood, which eventually will go into the, you want it to go to the kidneys, right? Because that's the easiest way to pee out toxins, pee out waste, unless you want to poop all day. But yeah, so the problem is not people encounter is not how many hours. That's not the key, right? The key is what you're doing during that fast and what you're doing when you're not fasting, when you're eating. That's the key. Most people are making mistakes during that portion. So if y'all have more questions about that, type into the chat what you're actually eating, okay? Let's say, Pro Joyce said, okay, Sosa boss, do I need to detox before I do a 30-day liquid fast? No, you don't. That 30-day liquid fast, you're naturally detoxing. You don't need to take any, you don't really, I mean, I take this back. If your body, it all depends on your organ function. If your organs are just terrible, they're just not functioning that well, like you go get your blood test and you have, all of these markers, your kidney function's got a problem, your liver function's got a problem, your gut's got a problem. It's like you got so much problems. Yes, you may need some help, like supplements, Chinese herbs, to help your body be able to detox effectively. So again, it's different for everybody. And that's why you need to find a healthcare practitioner. You need to find someone who is specializes in restoring organ function. Now, this is key. Someone who specializes in restoring organ function. If someone tells you, oh, you just need to take these supplements, they don't know how to restore organ function. You need to find someone. Could that be a physician? Yes. Could that be a functional medicine practitioner, chiropractor? Yes, it could. Could it be an acupuncturist like me? Absolutely. Could it be a nutritionist? Yes. Could it be a dietitian? Yes. Could it be a naturopath? Absolutely. The degree doesn't tell you their specialty, and the specialty doesn't tell you if they're effective, right? So very important on who you choose. Okay. What's the best food to break a fast? Great question, Smith Stella. So that depends on when are you fasting, right? So most people like to fast in the morning. They like to skip the breakfast and eat lunch, right? So I would start, right? And it depends. Some people are vegetarians. You can fast if you're vegetarian, okay? Lots of vegetables. I would stick with vegetables. This is very, I would say, it's consistent across the board. Vegetables and some type of animal protein, right? It can be chicken. It can be fish, like I'm doing it right now. Like right now, we are running our 28-day, Divine Farmer Health is running our 28-day metabolic fast, not metabolic fast, 28-day metabolic reset. And I'm doing it, right? Chris and I created it, and I'm doing it. So it shows you we drink our own Kool-Aid. So I'm currently doing it. So what I do to break my fast is I do vegetables with an animal protein. And the protein that I'm doing right now is chicken, organic chicken, all organic, and wild caught salmon, right? That's what I'm doing to break my fast. But here's the thing, I don't eat that much. I would probably say I probably eat about 4 ounces of animal protein, and probably 2 cups of, or maybe a cup and a half of vegetables. That's it, because I'm paying attention to my body. So I'm doing that because I'm about to go onto an Asia trip and I want to be ready to eat. So I need to lose some weight too and detox. Okay. And so during fasting, is plain water the only thing you can have? I already answered that question, Didi. Yes, it is. What if you very rarely feel hungry? Kelly asked. Yeah. So having, not having a voracious hunger all the time is a sign something's not working in your body. some organs are dysfunctioning. The opposite, what Kelly was asking, what if you never feel hungry, right? That's also a sign your organs are not functioning correctly. So you need to first go to a healthcare practitioner, right? You can go to whoever you want. I'm not telling you who to go to. I'm just telling you, this is what I do. This is what my family does. This is what my friend, I recommend my friends. This is what, I own the largest acupuncture clinic in Austin, Texas. So we treat a lot of patients, and this is what we recommend our patients. Patients come to us because of what we do, our specialty. Our specialty is restoring organ function. No other clinic does this in my city. And so it depends on who you go to. I would go to someone that, hey, focuses on restoring your organ function. First, so how do you do that? It's a two-step process. Number one, you identify, you do diagnostics. Again, this is why I love Western medicine. Don't hate your doctors, guys. I love Western medicine. Go to your doctors, get some diagnostics, get some blood tests. If you need to get some ultrasounds, EKG, or whatever, get those tests. They don't tell us everything, but they give us data. We need more data to figure out what organs are dysfunctioning. So the goal of those data, here's how we differ. The goal of those data is to identify which organs are dysfunctioning, and then go in and restore those functions. So two-step process. Number one, you find out which organs are dysfunctioning. Step two, restore their function, right? So that will fix your not feeling hungry problem. All right, Event Hats NYC asks, can it be a psychological depression symptoms that cause hunger? Absolutely, absolutely. Mind-body connection, it is 100% real. Think about it. Let me give you an example. I can make you salivate without having you eat anything, right? I'm not going to do it now because I only get about 3 minutes, okay? But I'll do it really quickly. If you just imagine, if you close your eyes and you imagine, okay, let's say I got a little stress ball here. So let's say this is a lemon. You're holding a lemon in your hand. Now you take a knife and you cut that lemon, and you're like, cut it, right? And you see all the juices squeeze out, right? And then you peel open that lemon, right? Okay. And then now you're going to take a slice of that lemon, and you're just going to stuff it. You're going to stuff it in your mouth, and you're going to bite down on that lemon, right? So what just happened? A lot of y'all probably started salivating, right? But here's the thing. You weren't really actually eating a lemon. But because I changed your psychology affects your physiology, which is your body. So by I changed the way you think, I cause you to do a physical reaction, which is salivate. So absolutely, depression can affect your hunger, right? Is it okay to fast for persons over 50? Absolutely. Fasting it doesn't discriminate. Fasting, you can fast whatever age. My dad is 82. Let me see, 42. So it's 2023, right? 81, sorry. He's 81. He still fasts. Okay. Can you fast if you're skinny? Absolutely. Great question, Maggie Bram. Fasting, again, is not about weight loss. What did I say fasting was to do? Number one purpose of fasting is to activate autophagy. In layman's terms, number one purpose of fasting is to clean your body, is to activate your street sweepers, your trash dumpers. That's the number one reason to fast. If you're skinny, do you collect waste? Absolutely, you collect junk in your trunk, right? So don't you need to clean that up too? Right? So definitely. Now, your fasting, again, will be different depending on your organ function. All right, guys? Great questions, guys. I love these questions. Hopefully, I hope you enjoyed this session, this Q&A session. If you do, make sure, tell us what you want us to want to hear from us, right? From Chris and myself. Chris will be back next week. Tell us what you want to hear. If you want us to do a lot more Q&A, let us know. Hey, if you don't let us know, we don't know, right? Then we're just going to start dispensing other information, right? So a couple of things that I'll leave y'all with, because we are at the 30-minute mark. Thank you. I am humbled that you think enough about us to join us in this conversation every week. Our goal is to provide you with value, and so let us know if we don't provide you with the value that you want, because that's the purpose of this podcast. It's to help you live a higher quality life, help you to be able to enjoy your life, not just get by through it, right? Be able to enjoy those weddings with your kids, be able to hike. A lot of people on vacation this summer, being able to enjoy the vacation. What's worse than going to Hawaii and having a migraine and you can't go snorkeling, you got to sit in your hotel room. You can't even look at the view because you got migraines and the light is stimulating to you. What's the purpose of that, right? Let's enjoy our life. And we're here to help you do that. We've been running a 28-day metabolic reset. It's not too late to join. You have access to it till August the 30th. So really, as long as you join now, before August the 1st, you're still good to go. It's 28 days. So join now ASAP. I'm doing it right now, right? I'm doing it with you. And here's another benefit. When you enroll in any of our programs, you get to join our private Facebook group where you get to ask any question you want, right? And that's where we spend a lot of our time answering those questions every day, not just once a week, right? So make sure you hop on that 28-day metabolic reset. If it's not for you, hey, it's okay. We're here to help either way. Get your friends and family to follow us so they can get on this podcast as well. All right, guys. Love you. Appreciate you. And give us some feedback. Let us know, good or bad. We love to hear. We believe in transparency. All right, guys. We'll see you next week.